Hello everyone, I have a wonderful patient of mine. She was actually done at the hospital. She is 4 weeks out from removal of textured saline implants. And these were below the muscle and they were removed definitively, completely, along with the capsule, with no inflamed tissue, no capsule left behind. She was done at the hospital because she's dependent on 5 liters of oxygen at night, given her lung situation. And now let me ask you this: how do you feel about how you look today on, given your chest where you did not have a lift and you did not have drains?
I feel like I look better than before. I was scared to go through this procedure, but I had read a lot about it and I had seen a lot of doctors for my symptoms, and they could not find out through the testing what was causing it.
What were the symptoms?
My body would overheat from walking from the kitchen to the bedroom. And then I would start sweating on my head. It's very embarrassing, believe me. So I saw every doctor I could to try and find out why this was happening. And all of the tests came back negative. So,
Now, how do you feel now with regards to that excessive sweating? How is everything now?
well, I'm not moving around a lot, but at least I can go through my home without worrying about sweating all the time.
Now, this is very important. This is a unique symptom of breast implant illness where you had seen dermatologist, a thoracic surgeon, I remember you had told me, in regards to addressing this excessive sweating or the hyperhidrosis. And there was no other, you had exhausted all avenues, and it was something that was very much at the top of your list as why you wanted to remove. This is not something that you would hear someone, when you came to me, you were 68, now you're 69. But you can see good resolution of your signs symptoms from what you mentioned. Now, overall, how was your anesthesia experience? Because you got the same at the hospital that you do over here.
I had absolutely no problems at all with the anesthesia. I've always seemed to have one little thing that would go wrong, but absolutely nothing went wrong. It was a perfect surgery.
No, thank you very much. And this is, remember, we basically worked with the hospital anesthesia team, and everyone was prepped, and we worked as a team together to help make sure that your experience was the best. Now, you got the same surgery that the 25-year-old, 35-year-old, all my patients got. There was no compromise in any of your surgical techniques, and this is exactly how I offer to all of my patients complete definitive removal. We have complete removal of the capsule plus implant plus all inflamed tissue, and that you have microbiology done, all capsules removed definitively, and this is where you get the best chance to bounce back to a normal state of good health. Now, thank you very much for sharing your journey, and God bless you for being very generous with your experience, so that another patient can say, well, I may be 69 and I will look better than what I did when I had implants. And this is the point. You did not have any drains despite your age and given the intense inflammation that was present. And I'm very, very pleased with your progress. And I'm very happy that you were discharged from the hospital despite you being on the oxygen at home. And I'm very happy for your progress overall. Thanks again for sharing.
Thank you, Dr. Khan. And the women out there, don't be afraid, because it will change your life for the better.
Oh, no,
Period.
thank you. Very well said. Thanks.
You're welcome.